It's been heartbreaking. It's been just really heartbreaking. Because we're supposed to be helping these patients.
This Contra Costa Health nurse says some of the county's most fragile and medically complex patients are being left in the lurch.
There are people who are unhoused. Some of them have been going to the hospital, ER, multiple times in a week. A patient who had a diabetic ulcer was given to non-medical staff, non-clinical staff. They then didn't address it. A full body infection happened. He needed to have his leg amputated.
It's not just this one case, and she says it's not the staffer's fault. Incidents like this, she says, occur regularly through Contra Costa Health's Enhanced Care Management, or ECM, benefit provided through California's new Cal-AIM program.
We're transforming Medi-Cal. It's our journey to a healthier California for all.
According to the Department of Healthcare Services, Cal-AIM's ECM benefit is supposed to address clinical and non-clinical needs, meaning both medical and social care assistance. But in Contra Costa, the nurse and 3 other sources familiar with the system tell us the program has abandoned medical assistance altogether. They say ECM case managers, who are nurses who were already with the system before the program started, are now being instructed to focus only on social needs, like a member's access to a shelter or fresh food, or their non-clinical staff, like housing specialists, who aren't trained to properly refer medical issues at all.
They've been told if they don't understand what a health condition is, they just should Google it.
That sounds potentially dangerous.
It's extremely dangerous. It's negligent.
Do you have firsthand knowledge of patients being harmed or dying as a result of this?
Yes. Yes, I do.
One fatal case she warned supervisors and county officials about through email last year involved a patient saying he couldn't get out of bed. A non-clinical staff member unknowingly labeled this patient as bedbound, and the rest of his care team treated him as such by only providing telephone visits. As a result, the patient didn't get out of bed for months, and his bed sores turned into bone infections. He later passed away, according to her email. Another ECM patient she emailed about received no discussion of health needs or health interventions for a year. When he was clearly sick, he was on death's doorstep, then passed away a month later.
I tried so hard to report this internally, and those concerns were both dismissed, and then I also received just the extreme hostility, abusive treatment.
We reached out to Contra Costa Health CEO Anna Roth. She declined our interview request. Instead, Kim McCarl, their communications officer, spoke with us.
Are members' clinical care needs addressed?
So the way that our model is set up, no, except that ECM is a part of the entire care model.
But I was looking at the state's description of ECM, and it seems to be pretty clear. It says here, ECM is a comprehensive care management benefit to address both clinical and non-clinical needs for the highest needs members. So why isn't that happening in Contra Costa County?
Because we don't need to. So Contra Costa County is what we call an integrated system. So we have a whole clinical arm, and we have a whole ECM arm. And so we don't need to have our ECM program provide clinical care because our clinic system does that.
But it doesn't always, and cases fall through the cracks. That's what the Department of Healthcare Services found in a 2023 audit of Contra Costa Health after receiving anonymous complaints. The state found patients complained about not receiving enhanced care management services. In one case, a comprehensive history and physical examination wasn't completed, and without proper assessments, the state said patients may not receive important behavioral and medical health screenings that can help identify and prevent illnesses.
Does the state know that Contra Costa County is not providing clinical care through its ECM programs?
Yes. Mm-hmm.
When we reached out to the state, a spokesperson repeated in an email, both clinical and non-clinical needs must be addressed by ECM teams. There are a lot of taxpayer dollars involved. Contra Costa Health took in nearly $3 billion in Medi-Cal revenue in 2022 and 2023. Of that, it spent $56 million on ECM, according to the state.
I think that it's wrong.
This nurse says she's concerned cutting corners on medical allows the system to report more patients to the state to get more funding.
It gives them an excuse to really inflate caseload sizes, and because by ignoring clinical needs, it's totally manageable to manage just the social needs of 100 patients.
Contra Costa Health denies that serving more Medi-Cal ECM members means more money for the system.
The state actually determines the formula upon which we get paid. So having more of them is not a financial benefit to us.
Tonight, we have an NBC Bay Area exclusive. The State Justice Department has launched a criminal investigation into Contra Costa Health, which is a major East Bay healthcare organization run by Contra Costa County. Meanwhile, another state department says the healthcare system is taking action to fix problems that we exposed by our investigative unit. Our reporter, Candice Nguyen, has the inside story. Candice.
We spoke with the nurse who blew the whistle when officials failed to listen to her concerns about patient harm, even patient death. She says she spoke with us, and tonight she is revealing her identity.
I think that it's wrong.
Disguised in shadows when we first heard from her in May.
It's been heartbreaking. It's been just really heartbreaking.
Contra Costa County nurse manager Irene Graham says her tears have turned to conviction and she's stepping into the light.
After the first story came out, that actually was part of my, a breakthrough in relief for me, because it meant that this story was being told.
Enhanced Care Management, or ECM, is a state benefit that's supposed to serve the whole patient, both their medical and social needs. Graham says since 2022, Contra Costa Health Plan has been ignoring medical needs and as a result harming Medi-Cal patients through its ECM program. Contra Costa Health Plan serves roughly 200,000 of the county's most medically complicated community members. This email shows last year Graham reported falsified medical records to county leaders. Patient visits, she told them, were labeled and billed to the state as public health nurse visits when either no visit took place or it was handled by someone without medical experience.
How do you have firsthand knowledge of that?
I witnessed it myself.
The problem resulted in serious harm, she says. Graham reported a patient dying after his bed sore turned into a bone infection. Another patient, she said, died after receiving no health interventions for a year. We reached out to Contra Costa Health, including their CEO, Anna Roth. They refused to answer our questions, saying the issue is a confidential personnel matter, even though their spokesperson at the time talked about it in an earlier interview.
We're hearing concerns that visits are being labeled as public health nurse, PHN visits, but they're actually being conducted by staff members who aren't nurses.
So, I guess I don't understand what there's no real implication to that, so we don't charge differently, we don't necessarily care differently.
There is now a criminal investigation by the State Justice Department's Medi-Cal Fraud and Elder Abuse Unit, according to sources close to the investigation. They got a tip from the U.S. Department of Health and Human Services. The tip referenced NBC Bay Area's reporting. When we reached out, the county said it's unaware of any investigation. Separately, the state's Department of Healthcare Services, or DHCS, tells us it's conducting its own audit. They say resolution of the identified issues remains in progress, and it's their understanding that Contra Costa Health Plan has begun to implement some measures to address the concerns. However, until their audit is complete, DHCS cannot confirm whether all issues have been fully resolved. The state has issued one finding, though, where enhanced care management patient complaints were not properly classified, which the county says it's fixed.
They finally reached out to me a year and a half after I made my initial complaint.
Was it after we got involved?
Yes.
Without admitting guilt, the county reached a $500,000 settlement with Graham after she complained to the state labor commissioner's office that her Contra Costa Health bosses retaliated against her for coming forward.
Screamed at me and told me to watch out, and they called the police and had me escorted out. Both shamed me and then also used me as an example to make other people be quiet and not raise concerns.
We reached out to Contra Costa Health about this. They wouldn't comment, saying it's a personnel matter. Contra Costa Health's public health director has since written this letter acknowledging Graham's dedication to patients' care and notable contributions to the ECM program.
I've never seen anything like that.
Jamie Walker is Graham's attorney. She's talking about that letter. Walker has specialized in whistleblower cases her entire career.
Nothing was done until I, as a lawyer and you as a journalist, got involved.
I do believe these programs can work.
Graham quit her job with the county, but she says she hasn't quit fighting for patients, for her fellow nurses, and for public health.
We should spend money on these issues. They're important issues, but we just need to make sure that it goes to the right place.